I'm Corey Howard, and lots of comments about stuff related to physician payments. So you may wonder, why is this guy talking about physician payments? Well, let me tell you something. I have 32 years of experience in the healthcare policymaking body, the American Medical Association. I have been a past president of a state organization, by the way, the third largest state in the country, as well as being chair of the delegation to the American Medical Association for 14 years. I've written literally, or had my hands on, hundreds of national policies, many of which have passed, and some are actually okay. But a couple of things that I think are really, really important. And what I want to show you today, and I hope this is a resonating message for all of those people that think that doctors, make a bunch of money and it's really important. Well, take a look at this graph to start, okay? This is nothing but a fact. Physicians have had a 29% decrease in payment from Medicare over the past, say, almost 20-something years, since 1996. Now, you can see in this graph that hospitals have had an increase in every year, and the practice costs, which is called the Medicare adjustment here, is actually increasing, but physician payments have not increased. So I don't know who's out there saying, oh, physicians are making enough money. Yeah, you may be making enough money, but you're not able to pay your bills. So when you're not able to pay your bills, you know what happens? You actually get gobbled up by a hospital system or a larger clinic or some other employer, possibly private equity. And guess what? Your life is basically over. What happens at that point is that you're an employee, and that's it. So you're capped, and maybe you make $200,000, maybe you make $300,000, but it's not really worth your time because you've already spent how many years? 10, 12, 15, sometimes even more years before you even step foot into the I'm making money world. And so you never actually ever catch up. So this is exceptionally important data that please look at here. This red line is the physician updates. You can see there haven't been any updates. Basically, and it doesn't even show it here, but since 1996, and the hospitals have had regular cost of living and inflationary adjustments over that time. So that's really important. I want to show you one other thing here. So when we're looking at this, this is actually since at least 2013, you can see over a 10-year period here that physician payments have not increased at all. There's been increase, decrease, a little bit of an increase. It went up about 0.5%. So this is a problem when you're trying to run a business. And people may say, oh, well, don't worry about running the business. It's not a thing. You should be okay. You should just take care of patients. Well, guess what? I can't take care of patients if I can't keep my doors open. That's the problem. That's why you have family doctors doing things like threads or procedures that they have absolutely no business doing. That's why I have people that have gone into emergency medicine that have gone into aesthetics, doing laser procedures or cosmetic procedures and things like that. I mean, yes, I'm sorry, doctors, if you fit into one of those categories, you guys have no business doing that stuff. You can get retrained, but if you want to be a cosmetic dermatologist, then go to dermatology. But the problem is it's so freaking hard to get into and so competitive that most of us can't get in, but you do it anyway. And guess what? The outcomes are not the same. Maybe you say your outcomes are great. All right, I applaud you for that. But the reality is that you should be trained to do the things that you do. And the reason why you're doing all these other things is because you're not getting paid because the system sucks. And that's the bottom line. And that's just a fact, by the way. That's not just me saying it sucks. It does suck. And so let me show you another graphic here, and you guys figure out how to adjust this here. I want to pull up this one here. So this is inflation and looking at the different costs in an office, whether it be administrative, workers in different places and things like that. You can see here that in blue, this is 2015 to 2020, and then 2020 to 2023, there's been a massive increase in cost. But again, the amount of money that doctors are making from the Medicare system has not increased. Now, we've tried very hard to have Congress make some changes, but that really that hasn't happened quite yet. And we are definitely working on that from a national standpoint, but it's going to take all of us. It's not going to take just a few people that go to the American Medical Association meeting twice a year to make some policy and then everybody bitch and complain on how terrible the organization is. Yeah, it has its own problems, but the reality is that it's $1 billion organization that may have the empowerment to help us help our profession. And that's where it has to go. But you know, one of the problems is this younger generation is all about the social issues. That's not the profession of medicine. I'm not saying that social issues are not important. They very much are important. But what's really important is being able to provide the care that you were trained to do. And so that's the bottom line with that. And so I'm going to make a plea to every single person out there to take a look at fixmedicarenow.org, fixmedicarenow.org, not my site. That'll give you a whole bunch of information. None of the gobbledygook, none of the kind of cutting, say, we don't really need this, and this is just factual information out there proving the problems. Because you know what? There are plenty of other problems in medicine. You know what some of those problems are? Prior authorization, try to get a medication. You know how many hoops you have to go through? You know that physicians' offices have to actually hire a whole bunch of people just so that the insurance company, some 12th grader, can actually tell you what you should or shouldn't order for a patient. You know what? How about you go to medical school? I think that's a reasonable thing to say. Why don't you go to medical school and then you could tell me and have a conversation with me? Oh, and then you're going to say, well, what about peer-to-peer? You know what? Peer-to-peer is right. Except when I do peer-to-peer, I get a psychiatrist or a neurologist or an OBGYN to tell me what GI thing I should do. And it doesn't make any bit of sense either. So the whole system's screwed, and prior authorization should be completely banned in the United States because it's all about the insurance company making more money, because that's all it's about, is just money. And you say, well, you know, the doctor, listen, physicians are less than probably 12% of the whole healthcare budget, but we provide all the care, not including nurses. Nurses, thank you very much, because you guys are great, both men and women, and we love you. But we have to work as a team. Nurse practitioners or APRNs now and physician's assistants, fantastic. You're not going to get me to say that you should have independent practice. We should be in a healthcare team helping people as much as possible, but we've got all the drivers of the finances to say, you should do this, you should do that. So please, take a look at the data, fixmedicarenow.org, take a look at things, and let's have a real conversation. You want to throw some comments online? You know what? Go for it. I'll respond to you. If you want to ask me a question, ask Dr. Corey Howard at gmail.com. I will respond to you. Yes, it won't be some bot. It'll be somebody, and that body will be me. All right? And so I think that's the way to go. And I know there are so many physicians online, and God, I really love some of them. Some of them are really, really great. I should pull up his name. I think it's Dr. London, I think his name is. He's a cardiothoracic surgeon, looks like a very cool guy. So if you're listening or watch this, give me a shout out. I'd love to have a conversation with you. Has great content and shows some stuff that I think is really cutting edge. Some other people, play doctor online. They really aren't physicians, have no clinical impact on patients, but they can say anything because that's the world we live in. So, so be it. That's the way it goes. But you want to listen to the people that have had some experience. What is my experience? That to me is a good question, and I appreciate somebody out there asking it, because my experience is that I have been in practice for 27 years. That's after going to medical school, that's after going to residency, that's after going to my fellowship as a gastroenterologist, and I'm one of those crazy people that decided, GI, forget it, and I'm going to go back and do general or primary care. And then, focus on health and wellness. And then I've segued that into kind of an integrative approach to people, which I think is really the approach to do. And so again, we're looking at physician payment. We understand that this is a real problem and we need to do something about it. And I'm asking for your help.